I chose to go to PA school because I was really interested in sciences. I wanted a career where I'd be able to help people, but most importantly, I wanted to choose a career where I'd see something new every single day.
I chose a career in healthcare because I feel like it's unique to any other career. When you go to work every day, you get to make a difference in somebody's life, whether it's big and small, it makes a huge impact. And I really do feel like that's unique.
I've always wanted to be a PA. It's something I've always known I've wanted to do. And the reason that I've known I wanted to be a PA is because PAs make a difference in the world and PAs make a difference in people's lives, especially on the individual basis. And that is something that I want to be a part of.
I would like to be a PA because it gives me the opportunity to use my medical knowledge to help those who need medical care. And as a second year PA student, I actually got the chance to do that right now.
I first decided to go into the healthcare field in high school. My mom is a nurse, my grandma's a nurse, so it's kind of been in my family, and I kind of had an interest in it since I was young. But I decided on PA school well into high school. Just looking at the options, it seemed like the best fit for me for the 2-year program as opposed to 4 years of med school, as well as the hands on with the patient aspect of it too.
I knew I wanted to go into healthcare ever since I was a little kid because I was very sick as a little kid, and I'd been to a lot of doctor's appointments and met a lot of great healthcare professionals who were smart and made the right decisions to help me feel better. And as I got older, I realized that I could do that for someone else as a job. And so that's what really drew me to the profession. And I'm just looking to give back to the system that had helped me so much.
And I decided to become a PA because the PA profession really values patient care, treating a patient holistically, which means just not treating them for why they came into the office that day, but treating them for maybe, they have questions about their diet or they're concerned about something and they're feeling extra anxious, just helping them through all those things. And, as a PA, you really get more interaction with patients and you get more time to sit down with them and really talk to them about what they're going through and how you're just there to help them in any way you can. And I think for me, that's just the most beautiful thing about being a PA. And it really made me want to go into the field.
I didn't know what I wanted to be. My undergraduate major was biochemistry. And so I was looking at maybe doing something like forensic science or working in a research lab or potentially going to full medical school. It wasn't until then I actually discovered PAs as an occupation and fell in love with it.
I always knew that I wanted to go into medicine and healthcare. I'm actually an immigrant and I migrated from Pakistan. I grew up really seeing my mother practice family care, and I loved the way she interacted with her patients, and that's something that I knew that I wanted to do.
I wanted to work with people. And I think that being a physician assistant is a great way to study science and medicine, but also get to use your personal skills and work with a diverse set of people to make them feel better with whatever illnesses or diseases that they are experiencing.
What I like best about PA school is that we get to learn so many new things every single day. We learn in a problem based learning environment that allows us to discuss cases and come to a final diagnosis in groups about patients. And this really helps me learn, and I feel like it will make me a better provider in the future and will benefit my patients.
And the things that I like about PA school are is just that we get to challenge ourselves every day. It's really hard, but it's really rewarding because we see how much we've grown in the last 4 months, and just how much knowledge we've learned, and yeah, just grown a lot as people.
What I love most about PA school is probably the amount of information that we learn on a daily basis. It really is amazing how much material you can learn in one day. And since there is so much information to learn in the medical field, it's amazing how much we are able to take away. I also really enjoy our skills lab. That's where we get to be hands on and learn how to do different physical exams, and I really enjoy that part too.
I really like the community here. It's really nice to be able to just talk to anybody in the class about medicine and being able to have an intelligent conversation about it. I know a lot of times in high school and middle school, it can feel like you're in a competition with everybody, but you're all on the same team here and everyone's happy to share information and study with each other and share resources. And that's really great.
So, what I love about PA school is the collaborative environment that we have. So, basically, all of our classmates are treated like our colleagues. So, we just get a lot of interesting patient cases and we really work together just to work through them, to learn together, um, and just like learn about interesting things.
And I love that I'm finally doing what I've been passionate about for so long, and that it's very hands on. And I'm working through patient cases and I'm learning so much.
I think diversity is really important in the medical field because a lot of providers aren't people of color, and it's important to have representation in medicine so that all patients feel safe and feel like they can trust their providers.
I think any field that aims to serve its community, like medicine, thrives on having varied perspectives. And as we've seen, America is growing in terms of its diversity, and it's important to see that be reflected in the people that are taking care of us.
Another reason I wanted to be a PA and wanted to go into medicine my whole life is, diversity is really important. And as a Black woman and as someone who cares very deeply about caring for that population and caring for all different people from all different backgrounds, just helping all of those different populations is so important. And you have to be really open to dealing with the challenges that you'll face trying to take care of people who have been marginalized in the past. And I think for me, that's just the most important part about being PAs. I'll be able to be on the front line and help people who might not be getting the care that they deserve.
So, in the second year, you go on 9 rotations and you get about a 5 week glimpse into various specialties. So, I started with neurosurgery, where I was able to see patients with brain tumors and different spine abnormalities. I saw some cool CT and MRI scans. And then I had transplant surgery, where I observed and assisted in some live kidney donor transplants. That was a very amazing experience. I think my favorite specialty is emergency medicine. I really enjoy the fast paced environment and seeing different people and different ages and just having a wide variety of diagnoses to treat.
So I really just love the variety of clinical rotations. We get to go on a new one every 5 weeks. So I've done general surgery so far. I've helped with appendicitis cases. I've done my OB-GYN rotation and helped deliver a baby. And during my other rotations, you do a lot of counseling on medications and on diagnoses and the patient's health problems and whatnot. So it's been a really rewarding experience, and it's nice to actually apply the skills that we learned during our first year into the second year and into real patient cases.
Well, I love the ability to be able to actually practice medicine in a clinical setting, working with our preceptors, PAs, docs to help the patient best while still learning is a really great opportunity. And actually being able to make a difference in the patient's health and life is very rewarding. I definitely love emergency medicine. I like the acute setting. I like the fast paced environment. It's really exciting for me. Currently, right now, I'm doing a lot of procedures in emergency medicine. So I've done suturing, I've aspirated cysts and drained abscesses. So it's really cool and hands on. And I like that the most.
What I love most about clinical rotations is that I can apply what I learned during didactic year and actually apply that to real life scenarios because not everything's going to be black and white. There's a lot of gray areas and room to learn. And most of the time, you do have to think on your feet, which I love the most.
I am currently on my family and pediatric rotation in underserved community, and I get the chance to see patients that are immigrants, refugees, and those who actually are underserved, anybody in a low status community. And I get the chance to see them, help them, and basically start making a difference in their lives, even as a student. And that is a rewarding feeling. I would like to continue this.
Well, for me, I've been traveling for all my rotations. I've been to 5 different states so far. And every time I go out, it's very exciting to encounter different groups of people, to see all the diverse communities and cultures I've encountered, as well as encountering different healthcare systems and seeing how they all work and interact together. I'm very much a people person, so I love talking with everybody. And it's been a wonderful experience so far. Also, helped deliver a baby. That was exciting, especially seeing new life brought into the world. It's wonderful.
I was able to pick a elective clinical rotation, and one of those was at a heroin addiction clinic in Pittsburgh. And that was a really unique experience that I'm very grateful for, and got to learn a lot about addiction and how it's treated.
One thing I did to help prepare me for PA school while I was in high school is I took AP courses, specifically AP science classes. I really think that taking these AP courses helped prepare me for the rigor of college, and because I took AP classes, I felt prepared for the harder classes that I had to take in college, which ultimately led me to have a pretty high GPA when applying to PA school, and that's something that can make you stand out when you're applying.
I personally did some shadowing in high school, and just looking at all the different PA programs and what their requirements were, and touring schools and looking into the programs themselves.
In high school, I shadowed a bunch of nurses, doctors, PAs. That's kind of how I found out about the profession. And then I applied to colleges, and I applied to Chatham in undergrad. And that's how I ended up here.
And when I was in high school, I would just go volunteer at a hospital, see as much as I could. I did a research study. Getting exposure to science is really the key.
I'm excited to get my hands out there and help improve people's lives.
Just helping people overall, being able to make a difference while just having a great career in healthcare is probably what I'm looking forward to the most.
I'm looking forward to being part of a healthcare team and just, hopefully making a difference in someone's or my patients' lives.
I'm looking forward to just making a difference in someone's life.
So if you love science, if you would like to study medicine, and you would like to help your community or those who needed help medically, definitely the PA profession is the right choice. So I encourage you to pursue that career.